Hello everyone, how's it going? Today we're going to be finishing up our series concerning the control of cardiac output. And so today we're going to talk about the effects of heart rate on cardiac output. We're going to discuss hydrostatic pressure and the effects of gravity. And then we're going to talk about the respiratory pump and the skeletal muscle pump. So we know the formula for cardiac output is heart rate times stroke volume. And most of what we've talked about so far has really been focused on stroke volume's effects on cardiac output. So we talked about things like preload, we talked about contractility, we talked about afterload, but to this point really haven't discussed the effects on heart rate, right? Now, the reason, why the effects of heart rate on cardiac output are so complex is because, typically, if we're looking at the formula here, so this is heart rate times, that's a big R, heart rate times stroke volume, right? And so you could just assume based on the formula that, okay, well, if we increase heart rate, we're going to see an increase in cardiac output. However, what this leaves out is the fact that heart rate is ultimately going to impact stroke volume. And so the reason why it's going to impact stroke volume because it's going to alter preload, afterload, and then contractility. So as you increase heart rate, yes, there is an increase in cardiac output, but this typically goes to 100 beats per minute. And the reason why, further increases in heart rate can start to impact cardiac output is because, again, once you start to increase the frequency of the heartbeat of those ventricles contracting, what that's going to lead to is less time to fill those ventricles with blood. So, again, stroke volume here, that's going to equal EDV minus ESV. And so ultimately, if we start to increase heart rate, what that leads to is less end diastolic volume. And then that's going to have an impact on stroke volume and therefore cardiac output. So it's not just this straight line of heart rate increases, so does cardiac output. The effects of heart rate on cardiac output are really going to depend on the starting or resting heart rate, right? And we know that those who are more athletic, those who have a greater cardiovascular fitness, typically have lower heart rates. So the lower the heart rate, the greater the increase in cardiac output from rest, right? So that's why, athletes are really able, if you crunch out the numbers, if you're looking from resting heart rate to 100 beats per minute, they're going to have a greater absolute increase in cardiac output and a greater relative increase in cardiac output, right? So they're able to get out a higher percentage of their cardiac output, if they're more athletically fit, if they're, have greater cardiovascular fitness, right? So, and the reason why that cardiac output is able to increase so much from rest to 100 is because the increase in heart rate from 50 to 100 beats per minute is greater than the decrease in stroke volume, right? So we're seeing this jump in cardiac output going from resting to 100 beats per minute. And then, as we reach 100 and go above, if nothing else is left unchanged, that reduction in diastolic filling time can ultimately impact stroke volume and therefore cardiac output, right? And so we gotta interpret these effects of heart rate on cardiac output, because during exercise and upright posture, the increase in heart rate has less of an effect on cardiac output than the other determinants of cardiac output. And so again, a stress of today is going to be this venous return, this diastolic filling, because ultimately we need to keep up with stroke volume in order to keep up with cardiac output. Let's talk about the effects of gravity on central venous pressure and therefore cardiac output. First, we'll describe the effects of gravity in rigid tubes, which is not the case of our vasculature. Our vessels are more distensible, but again, let's just talk about gravity on the effects of this pressure here, right? So if we had a horizontal supine position, right? And if you think about our body, right, it does kind of act in this U-shaped curve where, blood is going to leave the heart and then it has to travel down, let's say, to like the legs and the feet, and then it kind of has to make its way back up, right? So the shape, kind of is accurate as far as if we're talking about blood flow, especially to the lower parts of our body. So you kind of get a reference of the entire blood flow here, right? So let's say, though, we have this rigid tubing, so the diameter is not going to change. The flow of blood is going to depend on the elements of the Poiseuille equation, right? The differences in pressure, the viscosity, and then the length of the vessel, right? So if we have a starting pressure here of 100 and an ending pressure of 0, as the blood travels along and gets further away, there is a greater length change, right, and a greater resistance. And so by the time you reach the midpoint, the pressure is half, right, 50 here, due to that pressure drop associated with the increasing resistance as we increase the length. So now let's orient this in an upright position, this U-shaped tubing, and then talk about the effects. If you had, a pressure of 0 to start and a pressure of 0 here, there's going to be no net flow of blood, right? Pressure inlet minus pressure outlet. When you multiply that 0 times all the variables, you get a flow of 0, right? But the blood or fluid, I guess we could say, within this tubing, the greatest pressure would be stacked on the bottom of it, right? And so basically what you're getting is gravitational forces impacting both sides equally, right? And so if you just had liquid in this tubing and nothing pumping it, right, all that fluid would stock up here at the up the tube, right, and then the hydrostatic pressure would be greatest at the bottom, the furthest distance away, right? So that's the H in that hydrostatic pressure equation, right? And so although there's no blood flow, there is that hydrostatic pressure. But let's say, now you have in scenario C right next to it, now we do have a starting pressure of 100 and an ending pressure of 0. Well, that's meaning that the blood flow is going to be the same as A, right? So basically the flow is going to be the same, but what you are going to see is a difference in that midpoint pressure, because now we're taking into consideration not only the midpoint, right, but we have to add the hydrostatic pressure. So we're adding that same midpoint flow that we see in A, but now since we're in the upright position and hydrostatic pressure will act upon this tubing here, we're going to see 50 plus 80, a pressure of the midpoint of 130. So this pressure midpoint that we see in example C, that's similar to what is going to occur at the feet, right? Because our heart is located at this reference point, and the greater distance we get away from the heart, the greater the hydrostatic pressure. So, on the arterial side at the feet, pressure can get as high as 200 mmHg. And so the greater distance below this reference point, the greater the hydrostatic pressure, and the greater that pressure midpoint here, right? So if we flip that, though, and look at points in our body above the heart, well, now hydrostatic pressure is going to decrease, right? So if this is the same distance away and we just flipped it, well, now that hydrostatic pressure is going to be negative 80 because our reference point is now down below. So that 80 gets subtracted from that original midpoint of 50, and that's how we get a midpoint in this scenario of negative 30 mmHg. But important to note that in this rigid tube example, that the inlet pressure and the outlet pressure is the same for all three, A, C, and then D here, right? So overall, the flow is going to be the exact same in A, C, and D, even though hydrostatic pressure is having an effect on that midpoint pressure. So on the last page with rigid tubes, we're not seeing much of an impact that gravity has on the flow of blood, right? Because, similar to here, you have a starting pressure of 100, an ending pressure of 0. Then you have this flow of blood that's just based on that, right? But in the case of our bodies, gravity does have an impact on blood flow. It's because our vasculature, our vessels, are more distensible tubes, right? So what we're going to see is that the flow of blood through B is going to be greater than the flow of blood through A. And so you see, these two different orientations of our, in quotes, cardiovascular system. How does hydrostatic pressure or how does gravity impact the flow of blood? Well, what's going to happen is that with distensible tubes, this blood flow is going to come downward, right? And then as pressure increases at this bottom point, the vessel is going to start to increase in its radius, in its diameter, right? As more blood is piled up down below due to that pull of gravity. So there's going to be more blood with a greater radius that flows through from this side here to this side here. The problem that we're going to have is that, the limbs have more of a distension in the veins and then the arteries, right? So you could sort of see this even if you just look down below. So if you held your arm down, right? So if you were in upright posture and waited a little bit and held your arms, your hands by your side, what you're going to see is that, you're going to see those vessels start to fill in with blood. And what that really is that venous pooling. What you're seeing is the veins, since they are more compliant, they are filling up with all this blood, as you go into an upright posture. And you could see the same thing in your legs too. All this blood is traveling downward. And so that's going to start to accumulate on the venous side. And the problem is with that is that as venous pooling in the veins increases, well, that reduces the amount of blood that returns to the heart, right? And so if we reduce blood volume returning to the heart, we're ultimately going to see a decrease in stroke volume, which we know is going to then decrease cardiac output, right? And so that's why, if you have people a lot of times standing in a still position for a long time, the chances of passing out due to that change in, hydrostatic pressure and due to that change in gravity, that's apparent. And a lot of times, sometimes those in military service have experienced this. This is a lot more common when you have people just standing at attention for a long time. But ultimately, those changes, that drop in venous return, drop in stroke volume, that's going to trigger the baroreceptors that we talked about, right? And so since we're getting a drop in venous return, a drop in stroke volume, a drop in cardiac output, well, this is going to trigger the increase in sympathetic nervous activity, which helps to increase heart rate, contractility, cardiac output, and then vasoconstriction in order to restore mean arterial pressure. So we're trying to increase cardiac output, trying to increase total peripheral resistance in order to keep up with mean arterial pressure drops that can be seen with upright posture. So ultimately, the body does respond, right? It is able to adjust, and therefore we are able to tolerate this upright posture. So again, that's our problem with upright posture as far as the challenges of gravity on our cardiovascular system. The heart is this reference point, right? And it's going to pump out blood. And as it delivers blood below the heart, the increasing hydrostatic pressure does help, for the arterial side, it does help to increase the flow of blood from the arterioles to the veins. But the problem with that is the more we start to collect in the veins, well, the less makes its way back. And then that's going to have an impact on stroke volume, cardiac output, and mean arterial pressure. And once that pressure starts to drop, our body needs to, have a response in order to keep up with everything during this upright posture. But if we flip that orientation now, if we look at parts of the body above the heart, right? So we have this flow of blood, let's say, heading towards the brain. But the problem is that since there is, the vessels are distensible, what's going to happen is that, again, hydrostatic pressure is going to be negative and is going to have an impact on this pressure point, right here on the venous side. And so what we're seeing is that, in the veins, this drop in pressure, the ambient pressure is greater than the vascular pressure. So these veins, above the heart can become collapsed. But what happens is that blood flow, is going to, travel up top. Blood, when the veins are collapsed, pressure is going to start to accumulate, and that's going to help force these veins back open and for blood to continue on through. But ultimately, we're going to have a reduced blood flow above the heart. So, the effects of gravity, ultimately, it increases flow from the arterial side to the venous side below the heart, right? But there is a reduced flow then above the heart. But the impact of, the parts of our body below the heart, increasing that flow to the lower limbs of the body in the upright posture. Well, the downside of that is, again, we start to increase the pooling of blood in the venous side, and that's going to have an impact, again, on cardiac output because more venous blood is pooling and less is being returned back to the right side of the heart. So ultimately, what I just described is a problem on our cardiovascular system, a challenge on our cardiovascular system due to gravity, right? Let's say, we have a person here. Again, this may take a little while because my tools, right? We have a person here. They have their heart, right? And they have, their limbs down below. If this person's in upright posture, again, I'm not the greatest artist here, just trying to draw the example. If we have the person in upright posture, what's going to happen is blood is going to start to travel down towards the lower extremities, right? And what ultimately is going to wind up happening is that blood flow is going to go from the arterial side to the venous side, and there is going to be venous buildup, right? There's going to be venous pooling, and blood flow below the heart is going to start to increase. And with that, less makes its way back. And so we're seeing, right, ultimately then an impact on cardiac output, right? And remember that the heart cannot keep up with cardiac output if we don't have the venous return to supply that flow. So this is a problem with upright posture, right? And we talked about one way that helps the increase in sympathetic nervous activity. But let's think about exercise for an example, right? By standing in upright posture, we could have a displacement and a lowering of cardiac output by 2 liters of blood per minute, right? And if we're exercising, cardiac output's probably going to be closer to 20 liters per minute, 25 liters per minute, 30 liters per minute, depending on how athletic the person is. And so if we want to keep up with those high cardiac outputs, how are we going to help redistribute that venous blood back to the heart? And so the next 2 slides here, we're going to talk about 2 mechanisms that do that. First one is the muscle pump. So here in part A, we could see the image, sort of a gross overview of our cardiovascular system in a sense where arterial blood is being pumped from the arterial side, making its way through the capillaries, and then going towards the venous side, right? And again, these veins are very compliant, so they're going to hold on to blood volume. But during skeletal muscle contraction, what occurs is that the skeletal muscles are going to compress this vein, right? And so pressure builds up, and all that blood that is stored within this vein, it's not going to travel backwards. It doesn't travel from lower to higher pressures. What it does, it travels towards the heart. So the pressure buildup, due to the contraction of the skeletal muscle, helps to drive venous return back to the right atrium. So the skeletal muscles work as a second pump down below. And so that's why when we're exercising, we're able to keep up with cardiac output, right? Because we knew that an increase in cardiac output is going to decrease preload, because the more you pump out, the more is going to wind up stored in the veins. But what the skeletal muscle pump does is that it basically neglects that, right? So we're able to keep up with preload, and therefore we're able to keep up with increases in cardiac output. So by the skeletal muscles helping to drive blood flow back to the vena cava, back to the right atrium, that helps to keep up cardiac output when it's high. So, as we're exercising, you may have said, oh, well, cardiac output goes up, so we're going to have problems with preload. Well, the contraction of the skeletal muscles basically help in order to keep up with cardiac output as it's increasing during exercise, right? So the contraction of the dependent limbs during that physical activity will minimize venous pooling. It minimizes the reductions in central venous pressure, the amount of blood heading back to the vena cava and the right atrium, and that increase in venous return is going to help to maintain cardiac output and mean arterial pressure during exercise. So again, the muscle contraction acts as a second heart on the venous side of the circulation, and as we increase exercise intensity, the more blood that is distributed back towards the heart. So we also have what's called the respiratory pump. So the phase of respiration can not only affect heart rate, but also it impacts the flow of blood returning to the heart. So let's draw something out to help sort of imagine how that is going to work. So I'm going to draw here a torso, not really to scale here, but we'll have the lungs, and then within the center of the lungs, we have the heart, right? And that's sort of in the middle there. And then down below, bordering the lungs, is going to be this diaphragm. And this diaphragm, and we're going to have, lectures in the future here about the pulmonary system and the pressures and the volume differences that occur during inhalation and exhalation. But to summarize it, basically the diaphragm contracts, right? And as the diaphragm contracts, the intrathoracic volume increases. And we'll talk again about the relationships between volume and pressure in the future. But as the volume of the thoracic cavity here is increasing, the pressures within will decrease. And, at the same time as this is occurring, the intra-abdominal pressure increases due to its decrease in volume, right? So ultimately, we're getting a change in pressure here at the thoracic cavity. And remember, the heart, right, that's our pressure outlet, right? So we're basically decreasing the pressure here, and since the flow of blood is dependent on delta P, and we're getting an increase in the pressures intra-abdominally, right, more of the starting pressures here, PI, and we're getting a decrease in PO, well, this is going to force delta P to increase. Therefore, during inhalation, and when this diaphragm contracts, we see an increase in blood flow to the superior vena cava. And that's basically what's predicted here, right? So we have right atrial pressure, and what we're seeing is during that inhalation, it starts to decrease, and that helps to increase the pressure gradients. And then therefore, we're going to see more blood flow, right? We're going to see more blood flow head towards the vena cava, and that's going to help the venous return and therefore help stroke volume. So we talked about, again, these two, the muscle pump, the skeletal muscle pump, and the respiratory pump here. Basically, what they both help to do is to increase that venous return, which increases stroke volume and therefore increases cardiac output, right? So that has an impact on cardiac output, and that will have an impact on mean arterial pressure. So that's it for this video. We talked all about today the effects of gravity on cardiac output, the effects of heart rate on cardiac output, and then we talked a little bit about how we basically counteract gravity within the cardiovascular system. At the first level, we have our sympathetic nervous activity that's going to help to offset the changes that occur due to an upright posture. But then we also have the skeletal muscle pump and the respiratory pump, which help to increase venous return and sort of help to diminish the impact that we saw due to upright posture. So these are ways that we are able to tolerate upright posture and that we're able to carry out exercise is because, we have these mechanisms that ultimately help to restore central venous pressure, that help to restore preload, and therefore help to restore stroke volume and cardiac output. Thank you guys so much, and I'll see you in the next video.